pain pumps. What are they? Who's a candidate? How does it work?
So intrathecal pain pump is a great tool for patients whose pain is out of control, nothing else has helped.
Okay.
And they're already on maybe too much medicine. They have all these side effects like constipation, even respiratory depression. They can stop breathing.
Okay.
So these patients, you can take that medicine and put it in a catheter right to the spine. And that reduces the amount of these side effects because you're basically taking that medicine to
Is it more medication or less medication?
It's actually less. Actually 1,000 times less.
Really?
So yeah, it can
So,
be
like, let's say
actually 300 times less.
So if it's like 300 milligrams, it might only be 1 milligram.
Right. So it's 300 times. That's actually exactly right. So
Okay.
So that's exactly what the ratio is. So it would be a lot less side effects on the body. So someone has, let's say they have like pancreatic cancer or there's some severe pain, or let's say multiple back surgery and nothing has helped. It could be a really good option to reduce that pain with a lot less pain medicine.
So if you take a pain pill, it
Right.
has to be, I guess, go through the liver and all of those
Right.
other things. So you need a higher dose.
Yes.
So with this, so I understand this correctly, you're going directly to where the pain is being generated from.
Right.
And just
So-
putting a small dose
Yeah, well,
on the
you're-
nerve? Is that what we're talking about?
Yeah, so it's actually going to right where the receptors are that help.
It's hard to dummy this down.
Yeah,
probably.
the dorsal column is basically the nerves in the spine is where all these pain medicines end up going to. Okay, so you're basically putting that medicine right on those nerves, right where by the time you eat a pill, like you said, goes through your stomach, goes through the liver, it gets to that spot. It's going to be, you're going to have to go through all the side effects where that medicine's going, whether it's the respiratory depression, you're going to stop breathing. It's going to, go to maybe cause you itching. It might go to the receptors that cause you constipation, right? So you're skipping all that. You're going straight to where the source.
So this pain pump, is it remote control? It's implanted?
It is implanted.
Could they increase the dose?
Yeah.
And what about the dangers of increasing it too much?
Well, we are careful about it. So we program and we put limits on it, and we come up on it slowly till the patient's comfortable. But we start at a dose that's relevant to what the patient may be taking already. So that way, we're not going to go too much because the patient's already taking that.
Have you had people that it works like it's great for them?
Yeah, there are patients that it has really worked great for them. I find that the cancer patients that have had some severe pain from cancer pain, that's where it's worked the greatest.
So if it's as good as you say it is, why aren't they all doing it? I mean, it sounds like a pain pump, especially if you're on medication. Why not do it? What are they afraid of?
Well, people are worried about a foreign device being placed in their body, and they have the right for that concern. It is a procedure, but if you are having such severe pain that it's disabling, then it may be a really good option for you because it's really helped a lot of people.
And pain patients, is this true? They're stubborn. Because the people I know, it's like they have low patience, very little patience.
Right.
So I guess, does that interfere sometimes with you trying to give good advice?
Right, and
because they're in so much pain.
They're in pain and they're reluctant, and honestly, I understand that. Some of these things I would be reluctant even myself. It's just we've seen how they work, and they work really well for people. So it's an understandable reluctance sometimes.